Good morning. It's Dr. John Bennett from Miami Beach, home of Neurosurgical TV. We have the pleasure of having Robert Spetlzer, noted neurosurgeon, and I'll let Juha introduce him. Good morning, Juha.
Good morning, everybody. Good morning, Professor Spetlzer. So I take my short introduction. Of course, this man, can you share? Can you see that now?
Yeah, I can see you.
Not like this one.
Oh, okay.
Big. This one, yeah. Okay. Okay, welcome everybody. So I think now we have extremely good possibility to see Dr. Spetlzer to present about his career life in neurosurgery. This is how to become a good neurosurgeon. I saw anyone who wanted to be a bad neurosurgeon, but to be a good neurosurgeon, to be excellent neurosurgeon, you have to have good hints and take a careful look on what's following now. So 2 words. These are trained hard. Robert Spetlzer has trained hard also in sports. He's famous of that. He wanted always to be #1 in every sports, but also in neurosurgery, as you know very well. So to become an excellent neurosurgeon, you have to find heroes, mentors, and friends. And I think for me, Professor Spetlzer has been always far away hero, far away mentor, far away a friend. This is what you need in neurosurgery, because you cannot do neurosurgery alone. So you have to have some picture of the world and support in the world to make it well. So this is the 2009, Professor Spetlzer came to Helsinki to be opponent in Dr. Martin Lehecka's PhD on pericallus artery aneurysms, huge material with more than 500 patients. And in the morning before the dissertation, I showed him one pericallus artery aneurysm surgery. We made it very fast because we are very experienced, but he was a little bit confused because he's operating these patients in a lateral position. I'm in supine, so he couldn't understand the anatomy exactly. And Dr. Martin Lehecka made him an extra PhD book where all the pictures were turned 90 degrees. But we did very well together. He was very busy, could stay only 2 days by us because he had all the world to travel. So, but he had also time to make a foreword for our Helsinki book, which has been translated in many languages. So he always could find time to support neurosurgeons all over the world. And this is one of his specialty, to support, friendly support. So neurosurgery has 3 parts: operative skills. There's no doubt that Professor Spetlzer is the highest level of that, but he could also manage research, clinical and basics, and then of course teaching. He has been taught huge number of residents, fellows, so an army of successors around the world, and is one of those selected to be one of the most important neurosurgeons during the 100 years. Here you see him. He has published a lot. I looked at PubMed. Now he has more than 900 publications, and with all the book chapters and so certainly by far more, 100. So he has shared his knowledge, and many people are following him. He has trained the best young people, and many of them maybe are not becoming better, but try very hard to become his level. So thank you very much. This is a short introduction. If somebody in neurosurgery don't know the name of Robert Spetlzer, then he's actually not involved in neurosurgery. So please go ahead, Bob.
Thank you, Juha. Start sharing screen. This one. Oh, yeah.
Okay.
Can you see my screen?
Yes. Coming up.
Okay. You see the full screen?
Yes.
Wait a minute. Slideshow. Here we go. This should do it. Do you see me?
Yes. It's perfect.
Oh, yes.
Perfect.
Well, thank you, Juha, for the kind introduction. I did get the schedule screwed up somehow because I thought it was in 1 hour. But here I am. The same occasion that Juha mentioned, we've had a long friendship. I've admired his skill. I've admired his courage.
I'm sorry. I'll take care of that.
Okay, yeah, but you can still hear me.
Yes.
Yeah. On the occasion that Juha already mentioned, our friendship deepened. And as I said, I greatly admire his fortitude, his incredible surgical skill, and his tenacity to never give up. I want to show you my travels through the world of neurosurgery. And in many ways, I'm embarrassed because it's a talk that is really about me, which makes me very uncomfortable. I want to start off with my first visit to China and then really go through family. Why did I go into medicine, career, role models, last surgery, and can I still contribute? But my first visit to China was back in 1981. That was a long time ago. And China was just beginning to come out of the Western isolation. And here I am, a young neurosurgeon, presenting. You can see the screen was really a piece of linen. We observed surgery, very well done at that stage, observed surgery without anesthesia, limited number of instruments. My beautiful wife, who was a neuro-oncology nurse, went with us and visited the hospitals, made many friends. And this is Dr. Tu, who organized the meeting, and this is me back in 81, and some other academic colleagues. I was impressed by the amount of research going on. Here was one example. And the acupuncture that they really used as an anesthetic for one patient during surgery, very impressive. But it wasn't all work. We got a chance to see China. We got a chance to see the Great Wall. An incredible, virtuous, hardworking people that used anything at their ability to move the economy along. This was back when bicycles were everywhere. Cars were far in between. And yet there were smiles on people no matter what. So this is an Arizona scorpion. I'm not sure why this happened, but there down here was a plate of food. When I visited Dr. Zhao in 2001, where I ate for the first time scorpions. And then this is a scorpion that I got during a horseback ride just last week in Arizona, many times bigger. And then I came back in 2018, and naturally China had blossomed into this incredibly progressive industrial state with massive buildings everywhere. And at the same time had the ability to visit and see these incredible treasures from the past. So I have a lot of very fond feelings for your big country with its diverse people, diverse cultures, and I wish you well. And getting back to my story, I was born in Germany in a little farming house with my parents being presented here. And my parents had 6 children. I was the third. And my first encounter with medicine was a rather dramatic one. When I was 6 years old, I had a little cut on my foot, and I became sick. And at night and during the day, I would have these spasms. And finally, the doctor noticed that my reflexes were wrong and said, "You need to go to a specialist the next day." Well, that night, I was in a room right next to my parents' bedroom, which was unusual because they were so worried. And I had one of those spasmodic attacks and broke my mother's favorite vase. And they came rushing into the room. I expected a punishment for breaking this vase, and instead I got a hug. And in the middle of the night, we drove to Erlangen, which is near Nuremberg, which is the university hospital. And I have some vivid recollections. One is where they held me down and they cauterized that little sore on my toe. And then because my disease was so far along, they decided I wouldn't survive the night. And so they put me in a storage room full of the iron lung machines. And I remember my mom's face plastered against the little oval window. And she was pleading with the doctors, I was told later, to let me go home with them. If I was going to die, she wanted me to die at home in her arms. Well, they gave me a new medicine called penicillin, and obviously I survived. And I became sort of a star in the hospital where I spent a number of months. And I remember very distinctly being taken on a gurney to an auditorium. And the auditorium, to my 6-year-old eyes, was full of white coats, endless white coats. And I was placed on a little tiny table up front. And the professor who had actually saved my life took my robe off to show the reflexes, and I was incredibly embarrassed, just incredibly embarrassed. And I hope that somehow this helped me be a little bit more empathetic with my patients. Moving forward, 53 years later, I was giving a lecture in Erlangen, Germany, where Rudi Fallbusch was the chairman. That's Rudi Fallbusch, who made lots of contributions about the intraoperative MRI scan and pituitary tumors. And I think maybe only in Germany at that time, he presented me with my hospital records when I was there as a little child. Very, very nice. But back to my journey. I knew I wanted to be a neurosurgeon when I was very young. When I was in high school, in the yearbook that we published every year, what was my goal? It was ready to become a neurosurgeon. And so I had the advantage of really focusing in on this goal right from the very beginning. When I went to college, I did an honors project at a nearby laboratory where I worked on flow meters in a canine model. I went to Northwestern, which was in Chicago, because Paul Busey was there. Paul Busey at that time was the most prominent neurosurgeon in the country. He ran the Journal of Neurosurgery, and he became really my first professional mentor. He is the one, as a medical student, that sent me to Kryenbuhl and Yassergil, which was a life-changing events in my career. Here is Kryenbuhl explaining this stereotactic advice, and here's Professor Yassagil right behind him. I've always thought my residents should treat me that way as well. Paul Busey established a neurosurgery internship, which I took. And then he said, I'm going to be retiring soon, so I want you not to stay at Northwestern, but arranged for me to go to San Francisco with Dr. Wilson. Dr. Wilson then was a relatively young neurosurgeon and chairman, and it was a great opportunity for me. When I found out that I was accepted in San Francisco, I was absolutely elated, and I enjoyed every day of my residency. What did I learn from Wilson? Well, he had incredible dedication. He had complete commitment to neurosurgery. He had incredible drive, and he was very generous with his residents. My wife, Nancy, was his neuro-oncology nurse. And while I was a resident, I developed a percutaneous shunt. I convinced Dr. Wilson to let me go to Austria, where I met one of my dear friends, Professor Kuhs. And during my residency, we published our first book together, which at that time was called Clinical Microsurgery. And during residency, I also developed the normal perfusion pressure breakthrough theory when I observed in a patient that Dr. Wilson had taken out an AVM beautifully. Patient was doing well, and then a few hours later, deteriorated and had a huge hemorrhagic infarction. I think what is pertinent to this here is that travel and learning from others is an important part of career development. So I met Dr. Schmiedek when I went as a resident with my wife to Europe, and we did a lot of research together. I met Wolfgang Kuhs, who I published with the whole series of Atlas. I'll show you later. And I spent time with Ghazi Yassagil. At that point in time, he had become a chairman, and he demonstrated to me an ability of surgery that I always aspired to attain. Part of life is sharing it with others, and finding the right partner in life, I always say, is a lot of serendipity. I couldn't have been happier to have found my wife, Nancy. We got married up in the mountains in the snow. And along with my wife, I've had the fortune of having terrific friends and colleagues. We had a travel club and ski meetings. And some of these names you might recognize: Roberto Heros, Duke Sampson, Art Day, Nick Hopkins, all very prominent neurosurgeons. And we would meet every year with our families or without our families, exchange scientific information, and share the successes and the travails of going through our neurosurgical careers. But we also had a lot of fun. One of my dear friends is Ben Stein, who was also a mentor for me. He was a skiing partner, and we had skiing meetings in Europe or heli skiing every year. In 1983, I was recruited to the BNI by John Green. He was a great member, a great gentleman. And the BNI at that time was in dire straits as he was retiring, and we couldn't find the right replacement. And along with me came a neurosurgeon that was working in my laboratory, Joe Zabramski, a very dear friend. and I became Harbor Chairman of Neurosurgery. This is Mr. Harbor, who left behind $1 million to establish the chair. John Green was director still for 3 years. And what were my goals? I wanted one coherent group. What did that mean? It meant that the neurosurgeons that were going to be part of the BNI had to accept a vision. And what was that vision? It was subspecialization. That meant that everybody had to pick an area of subspecialty and be at the cutting edge. I wanted to create the best residency program possible, and I put all my energy those first few years into it. I wanted to create academic productivity because that's how you get recognized by your peers. I established at great expense an editorial office to help with publications and videos, etc. A research laboratory. I had a large NIH grant, and this gave an opportunity to the residents to experience research directly. And I found in Phoenix a gentleman named Volker Sonntag. He was a resident with Ben Stein, the one I mentioned before, who I went skiing with. And he's the one that alerted me to Dr. Sonntag being in Phoenix. And so I looked him up, and this is Ben Stein again. When I asked Ben Stein whether I should go to Phoenix, he said, great opportunity, go for it. By the way, Volker Sonntag is in Phoenix. When I asked my chairman, Dr. Wilson, whether I should go to Phoenix, he says, if you go to Phoenix, you will wither in the desert. It's like dying in the desert. Well, he became our first visiting professor. And then he said, may you and the BNI prosper. And in fact, when Charlie Wilson needed surgery, where did he go? He came to the BNI. So there are mentors. Juha mentioned the importance of mentors. And here are my 3 that I try to emulate. Charlie Wilson, because of his incredibly dedicated, focused work ethic. Yassergil, because of his surgical virtuosity. Charlie Drake, because he had such a generous personality. He was approachable. If you were a medical student, you had no trouble getting and talking to Charlie Drake. I believed in hard work, but I also believed that if you worked hard, you had to play hard as well. These are 2 of my early residents in my office at my fish tank. We had daily teaching rounds every day. This was early on when we still had the x-rays that had to be hung. I established the editorial office. I established the BNI quarterly, and we made presentations and publications. And we included activities like a hike from hell. This is going down a narrow canyon, beautiful, beautiful canyon in Sedona, a very difficult hike without a trail, going down a stream. You had to swim, which was very cold, make it through to the other side. We established the Grand Canyon hike every year. I have crossed the Grand Canyon 34 times. It is a very arduous hike, and it all built camaraderie. It all built, we are together in this. And many visitors from around the world would come. Here's the president of SAIS. We established Olympics so that once a year we had competition that included everything. Here's a pogo stick jumping contest, swimming events, biking, volleyball. We had visiting professor dinners, and I always included the spouses, and we had parties where we always included the kids. I wanted to build a camaraderie that helped everybody go through this journey of residency that was so much hard work. In 89, I took a sabbatical and I went to Vienna for a good portion and also visited Vinko Dolink. And we put together the biggest portion of the color atlas of micro neurosurgery. We had many visitors, Charlie Drake, Wilson, Yassergil, Janetta, one of my dear friends, and even the Pope visited one hospital in the United States, and it was ours. I believed in sharing knowledge, which was through publications, and here's one of our more recent ones. I believed in getting the best of photography, art. We had a medical artist, computer animation, anything to really be able to share appropriately. We human beings are very, very visual, and you want to be sure that you allow people to share in what you are trying to teach them. Well, how successful were we in academic productivity? Well, here's an article that came out of Mount Sinai in New York. And you can see that, in fact, the BNI is really right up on top. This is something that I just received last week from Doug Concioca. What they did is a Microsoft analysis of 700 billion entry, and you can see this outline here. I won't bore you with it, but in fact, we did quite well. Authors, highest ranked neurosurgical authors came from the BNI, way out there. We established a PhD program in neuroscience with the university, and it turned out a great opportunity for our residents or postgraduate people that wanted to focus in on neuroscience research. This is some of our research staff. We spend a great deal of money and raised a great deal of money to have an active research community. We developed, with the help of Mr. Eller, a Met Presence room. So this is me operating, and here's the audience sitting down in this room. They're here. They see the screen, what is going on in the operating room, and then they see the actual surgery on the screen below. So they really have everything as if they were in the operating room without having to be there. And that's the room we then used for daily rounds, which was one of my most pleasurable activities during the day, is exchanging knowledge, giving knowledge and learning from the residents, fellows, and the many, many visitors from around the world. We are not in isolation. We can't do it without the help of many, many others. And here are our nurses, and I've always had a great relationship with our nurses, and was rewarded by being their honored guest at their meeting back in 2006. The resident, this is one of our early residents, Dr. Hadley. He commented on why I was successful, and he said, never put off till tomorrow what you can have a resident do today. So, and there's a lot of truth, because my success is not my success. It is really the success of many, many individuals who all pulled in the same direction. Outside of my office is this wall of individuals that I had the privilege to train, and it is my greatest source of professional pride. So the question comes, as I came toward the end of my career, is, can I still contribute? And I want to share with you something that I've been working on for quite a while. So this is and he allowed me to use his name. This is Dan Barrow, who's the chairman at Emory, superb neurosurgeon, dear friend. Robert, please take a look at the attached images and let me know how you would approach this. And he attached the following PowerPoint. Patient with multiple hemorrhages has all these symptoms, which are very obvious based on this cavernous malformation that had bled. And you can see it's a relatively fresh hemorrhage. You see the location close to the tentorium, approaching the tentorium, up in the midbrain and pons. So what would I recommend? I said, I would use an extreme lateral superior cerebellar infratentorial approach, the most difficult portion of the lesion, but it is important to visualize to avoid leaving a remnant behind. So he sent me this post-surgery, beautiful job taking it out, completely gone. And remember, this is what I told him, good luck. And he said, thanks for your wisdom. I operated on the young man with the large midbrain and pontine calf mal. As you predicted, the inferior portion was the most challenging, but all went well. He dramatically better already and making a great recovery. I attached the post-op CT and MRI. A week never passes that I don't ask myself, what would Robert do? And not a week passes now that I don't get at least a couple of requests of how would I approach this lesion or what would I do, etc.
In this animation, we will provide the various exposures to.
So when we look at, for example, the lateral approach, there are so many subtleties as to what we want to achieve. How far anterior do we want to go? What do we want to resect? How much bone to take, and so on. And all these really depend very much on where is the lesion. How much do we take off? Well, if we want to get to this space, we don't have to take off very much. If we want to get farther up, we have to take off more, and so on down the line. So the subtlety of these lessons really is important. So I came up with what I called an interactive surgical atlas. And basically, this is what it's about. I plan many different routes into the brain, depending on where the lesion is.
This is a short presentation of a concept for a virtual atlas. The patient's MRI scan is reviewed and a lesion identified, which is then merged with a phantom, which has unlimited number of lesions. The lesion that closest response for the patient and the phantom is selected, and appropriate approaches are demonstrated. The best approach is then selected for stated reasons. And if one wants to use the robotic function of the microscope, it can align with the trajectory that has been chosen.
So the bottom line is that it recommends an approach specific for the lesion that the patient has. The menu includes alternate approach. It improves advantages, disadvantages, patient position, alternate position, advantages, disadvantages. Are there any specific pearls? Then there's a block, feedback in the cloud, where the user can agree. He would maybe suggest an alternative approach, suggestions, comments, criticisms. So here's a case example. We see a lesion here. It was merged with a phantom atlas. It suggested a supracerebellar infratentorial approach. It went through the advantages, minimal brain transgression, direct route, minimal risk of deficit, etc. Disadvantages, cerebellar veins, deep exposure, alternate approach, retrosigmoid, easy exposure, but difficult to reach the superior portion of the lesion. So what is the position for lateral? The goal is really to separate the shoulder from the neck. Then you go through, this is the position that I would use, supine lateral. There's the prone concord. Dr. Michael Lawton, who's the current chairman at the BNI, would use the sitting position. Everybody has their own nuances. So you can include in the MRI scan the anatomy and tractography as we go through it. Then pertinent anatomy, which is right there. You don't have to go to a textbook for this approach. It's all there. You see where you want to make your incision in the medial lemniscus. Then there will always be a example. This is down in the ambient cistern, fourth cranial nerve. Image guidance gets us right to the lesion. We make a little opening, no retractors in place. I've almost never used retractors in my last 10 years of practice. And then taking the lesion out. So everything is right at your fingertips, specific for that patient. So here is one more example. In this case, patient with multiple cavernous malformation, teaching the goal that you want to go through the middle of the cavernous malformation, not here, because you would have great trouble getting to this point. And then when you're done, you know where you are. So here you watch, this is what the atlas will show you. And then you can follow to see where you're going through. The little red dot is your exposure, getting you to the lesion. And all of this is right at your fingertips, being shown to you live. Same thing here with the various angles. The more we can visualize, the better off we are.
Let's review the surgical anatomy of the.
Then we go through the anatomy. These are actually little videos that pertain specifically to the approach that has been recommended. So that's the retrosigmoid approach.
In a patient.
And then again,
with multiple cavernous malformation.
We show a surgical example of the approach and surgical example of the lesion, and how we walk up the brainstem from the fifth nerve so that our trajectory is right to the middle of the cavernous malformation. No retractor in place, retrosigmoid approach, no rigid retraction, and that allows us to get right to the lesion and very small pituitary-like instruments to take it out. What are the advantages? It's progressive cumulative mentorship. We learn from each other and we share with each other. The ability to allow the surgeon to access what master surgeons from around the world think. Ability to send feedback, collaboration, utilizing and imaging. So I want to finish up with the rest of my journey and my final days in the profession I love. The AANS put together the first satellite symposium, and it was an incredibly touching symposium because so many of my colleagues came from around the world, and there's Juha and Vinko Dolink looking a little bit older, and Dr. Sontag and Michael Lawton, who has taken my place and doing a superb job. And they rewarded me with the highest AANS honor, the Cushing Medal. A deeply touching affair. More to home was when we had a final dinner and a whole series of events. When I finished, we have a roast, which is very, 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 very difficult if you don't have broad shoulders. And there's my wife laughing when somebody's making fun of me. My fellows, that established the Spetlzer Society presented me with a plaque, which I prize and is hanging in the BNI up on the wall. And the bottom line was, we honor you by continuing your legacy of pushing boundaries and not accepting the status quo in neurosurgery and in life. Ad astra per aspera, which means through hardships to the stars. And then came the night with 1,000 guests of colleagues. These are the female residents and attendings who have trained with us. It was an incredible special evening, and then a complete surprise at the end when this is the president of the system and the president of our hospital presented me with the name on the BNI tower. Very impressive. So my last operation was middle cerebral artery aneurysm, almost 6,500 aneurysm. Took a selfie on that. I think maybe they're all clapping because they're rid of me. They're not going to see me anymore. But it was very touching. And then my residents insisted we take the elevator. We normally always take the stairs. So we did. We took the elevator down, and this is what happened. Walk out of the elevator, and a very awkward moment, because what are you going to do? I thought, well, that's it. I turned the corner to be free, and it just keeps going. These are nurses, staff, residents, patients, colleagues. I had tears in my eyes as I walked down, and it just wouldn't stop. Well, so I want to leave with what words really have meaning in this career. Serendipity, being lucky, being fortunate to be somewhere at the right time, passion, outside interest, family, commitment, research, travel, opening, ethics, easy rule for me. Do unto others as you would have others do unto you. Colleagues and friends, mentors and mentoring and contributing. So we are truly privileged to be in the greatest specialty. Honor it and give it everything you have. Finally, this is where we make a difference. This is an 18-month-old with a dissecting aneurysm. How do we treat it? No retractor. We find the lesion. That's A2. We take off the dissecting aneurysm. I take the frontopolar artery from the contralateral side and patch the opening, providing also a bypass. And so this is what we did. Easier to see. And then patching it. And this little girl did just fine. Smartest girl in the class and is the best reader. So off I go with incredible gratitude for the serendipity that was my fortune. Mentoring is a reciprocal process where giving and receiving are the ultimate reward. Thank you. Don't forget to dream. They may come true. It is the journey, not the destination. Thank you very much.
Excellent, Robert. Juha, are you there?
Hello, can you hear me?
Yes, we can hear you, Juha.
Okay. Dear Bob, so it
I
was extremely wonderful. So you had many people when you went out after your last operation. All the world is with you, and we follow your great legacy, and we will change the world like you did. Thank you very much, Robert.
Thank you, Juha.
Okay, Dr. Spetzler, would you like to hear from the audience? Would someone like to interact with Dr. Spetzler? Someone for a diverse audience?
Yes,
Go ahead.
I'm Dr. Harshad Parekh from Mumbai, India.
Welcome.
Thank you. I am really touched by the journey of Dr. Spetlzer. He has shown us and inspired us how to become a good neurosurgeon and a good human. Excellent work, very touching story. And you are the amazing star of a neurosurgery, which we can never retire from this planet. Best of luck to us and to you. You have taught us one more lesson, how to be good to the patients and to yourself. Thank you very much, Professor. Thank you.
Thank you.
Thank you. Okay, more comments? Open floor.
I have a question for Professor Special.
Go ahead, Manuel. Please introduce yourself, Manuel.
Yes, first, nice to meet you, Professor Special. It's a great honor. My name is Manuel. I am from Dominican Republic. Now I am a resident neurosurgery in Moscow. My question is for you is, if you can define yourself with one word, which one will be that?
Lucky. I think serendipity really is a major.
Oh, I'm sorry. We got. I got that.
还有一位老师的主任的职称。
Okay, I'm sorry about that.
No problem. Manuel, I don't think there's a single word. I think it's personality, being able to listen and being able to speak. I was just very fortunate. And as I try to impress is, although I get a lot of the credit, this is really a journey that was only made possible by so many people that bought into the vision.
Thank you so much. Very kind words.
Thank you so much, sir. You have been such a big inspiration for all of us. So when I was able to apply for fellowship, it was very unfortunate that you were already retired. But I remember that I sent you an email and you sent me a lot of wishes, and that really mattered to me because you are like such a big inspiration for us when we start our residency here in Pakistan. We always we learn your classification system for ABM. That's the whole thing that we apply. Thank you so much, sir, for sharing your very nice words with us today. And it's really something that really matters to us being young neurosurgeons. And we are always looking forward to hear from you. So thanks a lot for all your contributions and for all the wonderful words you shared with us today.
Okay, Nora, you're a resident from Pakistan, correct?
Yeah.
Okay,
Thank
welcome.
you, and good luck to you.
Thank you so much, sir.
Okay, more comments or questions for Dr. Spetzler?
Professor Spetzler, I'm Bing
Yes.
Xu. I'm translating for you. So I have a good news for you. Now almost 4,000 audience in Chinese WeChat channel are hearing your presentation.
Thank you.
Great.
Yeah, and thank you for the translation. Your English is just absolutely superb.
Thank you.
He's done a lot of translations for us to reach the Chinese neurosurgery community. So more comments from the audience? Now's your chance.
Hello.
Good evening. I'm Rafael. I'm a resident from Brazil. When I was in medicine, Dr. Spetlzer came over for a lecture, and I never seen any bypass surgeries, and he was showing all these bypass surgeries, and I was very amazed. I was asking him, Dr. Spetlzer, how do you come up with this? And his answer was, well, there's a problem, and we got to solve it. So sometimes you have to be creative. So this is really something that always comes back to mind when I face difficult decisions, difficult choices, difficult situations. And it was really a pearl that I got from you. So thank you for that and for inspiring everyone else.
Thank you very much.
Thank you. More comments?
Any comment for Professor Spetlzer is going to be less and less. The words are less, his work speaks. The volume of work and volume of teaching which he has, no one can match it. Thank you very much once again, Professor. Thank you very much.
Dr. Spetlzer, I have a question. The surgical atlas, it's available now for use?
It is still in development.
Okay, we'll keep in close touch. We'd like to hear about that when it comes out.
Fantastic.
Okay, Dr. Spetlzer, I think we'll wrap it up. Thanks. Sorry to wake you up earlier than you expected, but thanks for your dedication to show up and do it. So,
all right. You have a great day, and thank you, everyone.
Okay, thanks, everybody. And
thank you.
Thanks, Ben, for translating to the Chinese neurosurgeons. And we'll see you next week.